Welcome to this video on acute obstructive airway disease, focusing on evidence-based management of asthma and COPD in the emergency department. We begin by addressing acute asthma in the ED, highlighting clinical pearls for rapid assessment and stabilization from key emergency medicine texts. The pathophysiology of obstruction involves smooth muscle constriction, airway edema, and mucus plugging. These lead to air trapping, resulting in dynamic hyperinflation and auto-PEEP. Key red flags for severe asthma include a silent chest, paradoxical respirations, and altered mental status. High-risk features involve prior ICU admission or intubation and recent steroid use. Objective measures of severity use peak expiratory flow rate, or PEFR, to classify exacerbations. Pulse oximetry below 90% is highly predictive of the need for admission. Stepwise pharmacotherapy for asthma begins with duo-nebs. This is followed by systemic steroids for early management. For refractory cases, use magnesium sulfate, and in critical situations, consider a NIV trial or ketamine infusion. Next, we will cover the acute exacerbation of COPD, defining the management for the blue bloater and pink puffer during acute decompensation. The pillars of COPD management include controlled oxygen, targeting 88 to 92%, frequent bronchodilator therapy, and systemic steroids to shorten recovery time and reduce relapses. Non-invasive ventilation, or NIV, is the gold standard for AE-COPD with hypercapnic respiratory failure, reducing mortality by 50% and decreasing the rate of intubation. Antibiotics are indicated for patients meeting the anthenicin criteria. Selection depends on the patient group and risk factors, ranging from simple to high-risk exacerbation. For the crashing patient, invasive management is required when pharmacological therapy and NIV fail. Use ketamine for intubation and a ventilation strategy with a long expiratory time to minimize dynamic hyperinflation. Thank you for your attention. This video was compiled from Tintinelli's 9th edition and Rosen's 10th edition for medical education purposes. These are the image sources used in this video.